Greetings, greetings, greetings. Hello, everyone. Welcome, welcome, welcome to Health is Wellness. We're so grateful to have you here with us today. It is Wednesday, the second day of our Health is Wellness week, and we are so excited to discuss this topic because we know it affects so many people, and that is chronic pain management and cannabis. And it is really exciting to know that, pain, chronic pain, any of the diseases, whether it's lupus or MS that causes chronic pain, are listed as diseases in medical states that allow people to use medical cannabis. And so we're excited to be able to talk about this because a lot of times the doctors that are in those states have no idea. They don't know what to recommend. They don't know what type of a form of cannabis to recommend to the patient. So we're really excited to have a powerhouse here with us today. But Stanley, thank you so much for being here with me, my co-host today. Excited about this topic. I know that you do a lot of work with veterans and other patients in this area, and I know that this is something that's close to your heart. So tell us a little bit more about chronic pain. You're on mute, dear.
Thank you so much, Nicole. Introduction. Ladies and gentlemen, welcome to Health is Wellness Week, Day 2. This is chronic pain. What is chronic pain? Who suffers from chronic pain? Is the pain that you're suffering chronic pain? Well, today we're going to have two esteemed guests to discuss chronic pain. Did you know that chronic pain in many instances suffers, 1 in 3 patients suffer from chronic pain? Chronic pain is one of the leading causes for people who consume cannabis. We have seen statistics in some states that even rated that as much as 24% reduction in opioid prescription usage was linked to patients who had access to medical cannabis for chronic pain. So in today's episode, we brought in a physician and a patient to give you the perspective from both sides of the stethoscope. I'm going to introduce my first guest, Dr. Uma Dhanabalan. She's going to be joining us from beautiful Massachusetts, and we are awaiting our patient guest, Miss Denise Butler. Dr. Uma, welcome to Minorities for Medical Marijuana. Health is Wellness. Thank you so much for bringing your energy and your amazing expertise into chronic pain. So if you would, please tell our guests who you are, where you're from, and the work that you currently do surrounding chronic pain and medical cannabis.
Stanley and the whole team, and Day 2 of your Health is Wellness, and absolutely a pleasure to be here. And pain is something that people quantify, and I am a family physician. I am an occupation environmental medicine physician. I'm specialized in heavy metals, and very proud to say I'm a diplomat in cannabinoid medicine. And I've been writing recommendations for cannabis as medicine since 2012. So it's about a decade of experience. Originally, it was my adult population, and probably for the last, I'd say, 6 years, we've incorporated children under the age of 18 that are also part of our patients that we treat with chronic pain. And you had mentioned, well, pain is defined as anything actually that's been existing for more than 3 months is what would be considered as chronic pain. And I look at pain as something that got introduced into my life as a physician was in 1996, when pain became the 5th vital sign that was incorporated. And I remember being called in to a room in 1996, and we were told that if anybody had a pain scale, those little happy faces and faces that people see, and 0 is no pain to 10, the worst pain. And if they had a score of 5 or more, we gave them a prescription for this drug that was introduced, known as OxyContin, the one to start with, the one to stay with. And years later, we realized today we are facing an opioid epidemic, and last year we lost over 107,000 people in 2021 due to the opioid epidemic. So just to kind of put things into perspective of what we're facing today and what is happening. And also, United States of America is only 5% of the world's population, and we consume over 80% of the world's opioids. So my question always becomes, how are we so different? How are we so different that we have all of these conditions and that pain is being treated with all these pills and that we have an opioid epidemic? So I'm very proud to say that I, Dr. Uma Dhanabalan, has not written an opioid prescription, and I'm not part of the problem, but I'm part of the solution in saying that I haven't written an opioid prescription in over 15 years, but I have been writing recommendations for cannabinoid medicine for over 10 years. So that's where I stand. And I'm not saying that there's not a role for opioids and definitely a role for pharmaceuticals, but it's just a question mark of, can we offer something that's a little bit more safer, and can everybody have an access to cannabis? And the answer is no. Everybody does not have access to cannabis right now.
Unfortunately, that's right.
Thank you so much for that, Dr. Uma. We know that throughout your work and throughout your teachings, we've heard you really one of the strongest sentiments I have seen in the cannabis industry. There are a lot of patients that are interested in medical cannabis. There are clinicians that may be interested in it. And we know that opioids, especially Oxycontin and that class of opioids, they're a gateway drug to addiction. One of the ways that they were able to push the Oxycontin was stating that they were non-habit forming. They were non-addicting. I recently watched a congressional Senate committee where they stated that the usage of opioids would decrease length of stay. And for people who may not know what length of stay is, that is the amount of time post exam or surgery or treatment that a patient stays within the facility, which means staying overnight in a room. So if you put them on opioids, it reduces the length of stay, it decreases their bill. Well, we know that opioids are a gateway drug to addiction. And as Dr. Uma has continued to push in our community, cannabis is the exit drug, something that we stand by. And Nicole, I know you've heard this as well. Nicole, what are some of your sentiments on when it comes to an exit drug versus a gateway drug? What are your thoughts on introducing cannabis to more patients?
Obviously, I am an advocate for cannabis as medicine, as Dr. Uma said, and I've witnessed for myself. My mom came off of her pain medicine, her prescription pain, synthetic drug medicine for pain. She needs both of her knees replaced, and she replaced that with cannabis, with hemp. With RSO. And so I've witnessed it over and over and over again happening within our communities, that patients come off of opioids and are using cannabis and their diet to adjust how they're managing pain. It works.
Thank you so much. Dr. Uma, I have a question for you. You are currently in the Northeast. You're in Boston, Massachusetts. You have a hands-on access to a variety of clinicians, research facilities, and patients. Tell us, what is leading you in your practice for patients with uplifting health and wellness, and how does that tie into medical cannabis and their treatment?
My whole concept is that this is a tool among many other tools. And, Nicole, you mentioned diet, and this is something that I constantly say is that food is a drug. At the same time, Dr. Uma says food is medicine and cannabis is food and medicine. So this is where I really believe that we're right now in a community where Massachusetts has both a medical program and we have an adult use program. So it's accessible. And the benefits of being a medical patient are that there's different products that a medical patient has versus a adult use patient. There's also the strengths or what's considered the dosages of the products that the medical patient has. They don't have to pay the taxes. They are able to buy, variety of maybe products in different delivery mechanisms that maybe the adult use customer is not able to purchase. And we also are able to see that because we have a medical program here in Massachusetts, we're able to take care of children also. And this is very sad to say, but the most common morbidity among children is cancer. And these children are dying with pain. And it's also painful to see the parents that have to take care of these patients. And to me, pain is not just physical pain, there's also an emotional pain. And you mentioned talking about veterans and veterans PTS, and today the whole world is suffering with PTS. And I drop the D because I look at it as post traumatic stress. As soon as we add that word disorder or disease, it's that labeling of that person that, you're damaged goods. And we are not about damaged goods. It's about how do we look at the situation that we have and how do we make it better or the
That's
best
That's
that
right.
we can make. And this is where cannabis becomes a wonderful tool because we know that it's safer than opioids and some of the pharmaceutical drugs. And I also call it an exit drug because I truly have a plan how to lower, taper, slowly, very slowly, some of these pharmaceutical drugs that patients have been on 20, 30 years. And I'm able to slowly get them off and titrate is the word I use up and down on their cannabis use. And we educate them. We certify them. So we embrace this as an option at Uplifting Health and Wellness, and we empower them. I follow my patients. They know that this is not just about a 5-minute certification and here's your card and goodbye. That's not what this is about. This is about incorporating a tool, nutrition, looking at their vital signs, looking at their lifestyles, conscious use, safety first, do no harm is what Dr. Uma says. And that's something very different than what doctors in general are taught is do no harm. But
That's right.
cannabis me allows me to say safety first, do no harm.
And Dr. Uma, that's amazing. That's beautiful. We love that Dr. Uma says safety first. One of my questions for you is, as you've been at this for quite some time. You said you've been writing recommendations for more than 10 years now. And I've seen you testify in front of different legislators and different Congress and groups of elected officials. What do you feel like? What is your position on limited access for patients when it comes to products? When it comes to different delivery products. And then what also, to add on to that conversation, your answer, what are your feelings and your position about THC limits on medicines for patients? Unmute Dr. Uma. Sorry.
I think that here we go.
Okay.
So when you talk about delivery modes, there's different accessibility. I look at it as inhalation, and within inhalation, you can combust it, which is smoking it. You can vaporize it, and that could be flour, it could be liquid, it could be concentrates. There's a whole array of conversation around that whole part of what are the different products in concentrates. The question as far as suppositories, tinctures, edibles, a whole array of delivery mechanisms that are out there. And we educate patients about these different mechanisms because sometimes people can't get one method, they can only get one way. Some states it's only flour, or you can only get these edibles and you can only get it in what you mentioned, the dose levels, the THC levels. Now, this is very, very much a really mind-boggling thing, and this was something man-made, believe it or not, in the United States of America. So this THC level, if it's less than 0.3% THC, it's considered hemp. If it's greater than 0.3% THC, it's considered marijuana. Okay, and in places like Europe, it's 0.2%. Places like Thailand, they have different cutoffs. So it depends on which country you're in, where you are. But in the United States, due to the Farm Bill, the cutoff is less than 0.3%. So just to teach the audience out there, it's all cannabis, folks. It's all cannabis. But it's the percentage of THC that makes it hemp or marijuana. Now, in Georgia, there's low-level THC. So what does that mean? What do you have access to? What do you have as far as product? Where does the individual go get it? Who's got it? Who's testing it? What are the guidelines? Whole array of questions that I have. But in Massachusetts, we do have some guidelines. When it's medical, it has to be tested. It will give you a profile. So a patient is able to say a label and say, okay, indica, sativa, hybrid, which means it has some type of classification, and it'll give you a profile as to the THC, CBD, the other minor cannabinoids might be listed. Some of them even may list the terpenoids profiles on it, the terpene, what gives it the aroma. And some dispensaries will let you smell it, some won't. Depends on the place. With COVID, everything has changed. You can look at different products. Some of them, it's just, you're not able to look at products. So it depends, again, where you're getting the products from. But there's a whole array of ratios now, a whole array of cannabinoid profiles. So there's a lot of information that people have to digest.
Do you think, though, putting THC caps on medicine that is provided to patients is a good thing or a bad thing? What is your position on that?
It really depends on the individual and what we're treating them for. Like I have babies that are on 1,000 milligrams, and an adult may need only maybe 2.5 milligrams or 5 milligrams. It depends on maintenance. Is it for treatment? Is it for prevention? It really depends on what you're using it for. What is the condition? Is it cancer? Is it neuropathic pain? Is it post-traumatic stress that I'm dealing with? Is it diabetic neuropathy? Is it phantom pain? What am I dealing with is the question, and what is the conditions that the patient has?
Thank you so much. Thank you so much for that.
You agree then that the legislators shouldn't be making those decisions. It should be you and the patient, correct?
Well, it's really interesting because anytime you have legalization, you have regulations. Okay, so and I'm a public health, I have my master's in public health, and I'm always talking about how does this affect the public. So they're always trying to look at the in the bell curve, the 80% of the population, and making sure that we're protecting all of the people, not just the patients, but not just in general. So I understand what their concerns are, but you know something, I'm sorry to say it as bluntly as this, you wouldn't want me doing your plumbing work. You wouldn't want me doing your electrical work, right? So unless these people have some medical background, please come to us. Please ask me, and I would be happy. And ask the patients, ask the caregivers. You know, these are the people that you can actually get information from. And there's a thing called www called pubmed.gov that has lots of research that you can look into that's been around from all over the world.
Thank you so much for that, Dr. Uma. I know that you've spent a lot of time at different capitals in different countries. One thing that we know is politics and cannabis are directly tied together. And that is something that we as advocates do understand. So they always speak about research. There's not enough research. There's not enough research. There's not enough research. Can you tell us about any research that you've done or research that you have studied, and what type of support is needed to push the legislation agenda for legalization of medical cannabis?
Excellent question. So I've been a researcher, a lab rat, since probably I was 10 years old, walking around the labs, and then really actually got to do research from animal research, tissue culture research. I've been doing monoclonal antibodies. I was involved with cancer research, HIV. We did infertility research. So I understand the word research, but look at where we are from research. The opioid epidemic was because of research. Drugs were brought to the market and drugs have been pulled off the market. So my plant, as I call it, cannabis, is from my country. It's from India, Ayurvedic medicine. It's been around for thousands of years. And this plant, three facts that I want everybody to walk away with. Nobody, a big fat nobody, has ever overdosed from this plant. You may feel like you're dying, but you can't die because we have an endocannabinoid system and you cannot have it blocked. The second fact is this was written as a prescription by doctors, and it was in the United States Pharmacopoeia from 1850 to 1942, and it was used for the opioid addiction and for alcoholism. And the third and most important fact, we have an anniversary coming up on October 7th, 2003, was when the United States of America got the patent for cannabinoids as an antioxidant and neuroprotectant. So look it up, 663507. I'll repeat it again, 663507. So these are the facts that we want people to know. And the other questions as far as patients' access, we want them to know that this should be a first-line option, especially for our patients, that when we hear cancer and chronic pain, this is like, why do they have to go through all of this before they can get this as an option? And why should your zip code mandate where you can get access to?
It's a shame. Right, Dr. Uma. Thank you for being such a strong advocate for these patients out here. One of the questions that we had from our audience members that's listening in is it true that in some situations children need a higher dose of cannabinoids because their ECS is not fully developed? Can you help answer that question for Lisa for us?
You know, it's very interesting because when some of my seizure patients, we've taken them to very high levels. And even our patients that we've treated cancer tumors with, brain tumors, I've had babies where they gave them 6 weeks and we prolonged their quality of life and really gave them a better opportunity. And this is where I really feel passionate that if we can do more of the research that's needed, we can get these patients better care. And as far as our treatment and what we've done in my clinic is we've actually published data looking back at a retrospective study on patients that had a diagnosis of chronic pain in our clinic, 18 and above. And we had 30 patients that we looked at, and we looked at them over data points because I follow my patients 3 to 6 months and over a year. And we looked at, it had a control within a control actually, because every patient, we have to check a PNP on them. A prescription monitoring program is what we have to look at and see, are they on opioids? What prescriptions are they on before I certify them? And we're able to look at that through our electronic medical records, and we could see. And when that, what we were able to follow is that the patients that had opioids and no opioids, but were on pharmaceutical drugs. And over the year, we showed significance in reduction in opioids, reduction in the number of pharmaceutical drugs, reduction in their pain, and improvement in their quality of life. So we could do more.
Right. And so the research is that but you've heard this before, that maybe children might need more cannabinoids, and so but you're saying that the research needs to be there more to kind of help us show that these results are true. Wow. Thank you so much.
Absolutely. If we could write up more stories.
Yes.
So the doctors' case reports have to be written up. I mean, I'm one individual. I would love the help. If there's students that are interested, there's people that want to write, I would love to share these stories and how, we have data from the first prescriptions that were written here in 2014 in our electronic medical records. I don't know of anybody else that has those kind of data on patients and the data points that we have.
Absolutely, Doc. And I know that those data points are what drive programs. I think we've been down enough rabbit holes of legislation to know that not only do patients need laws passed, but patients need access to the medications once the laws are passed. As you stated, Georgia has a 5% THC cap for their products. And during our legislative process, they were really keen on the language and they did not qualify chronic pain as a clinical condition, but they chose the verbiage of intractable pain, which is under the similar premise. It's pain that cannot be alleviated by conventional modalities and therapies. So, with that, Dr. I want to talk about safe access because I know that you are really big for making sure that patients have safe access to safe medications. What are your thoughts on economic and how does that create for persons of color and patients to have access to a recommending physician because we do know that physicians have to charge for their services. And that'll lead us into my next question regarding our safe access program.
Okay, there's a lot of questions there. So the first thing is that yes, um, I don't deal with any insurance because cannabis is still federally in Schedule 1. And I'm tired of the bull crap I'm telling you that I have to deal with banks. They don't understand. I don't touch the plant. I'm a doctor that writes a recommendation for something that's legally allowed. I want to yell at the banks right now. This is going out to those people, the insurance companies that don't understand. I don't touch the product. As a physician, we write the recommendations for patients to get safe access. Now, they don't have access in many cases. And there's been a study that showed just because you have a legislation doesn't mean you're going to reduce the opioid epidemic unless you have access to the dispensaries. And where you do, boom, reduction in 25% in the opioid deaths within a year to 2 years. And it goes down further as we have more access. But we have to have the education. Otherwise, people don't understand how to use cannabis appropriately. If you use it inappropriately, it can lead to addiction as well. It's that simple. But you need access to the legislators. They need to understand that the levels don't mean everything. Okay, they have to understand that there's an endocannabinoid system, and under deficiency is just as bad as over consumption. And this is where I call it the Dr. Uma curve, the U curve. All right, if they can't remember anything today, remember the U curve. Okay, it's not the bell curve, folks, it's the U curve. Under is just as bad as too much. So finding your sweet spot is about you. It's all about you.
Remember the curve, everyone. Dr. says it's okay to click like, subscribe, share this video. If you know somebody that's suffering from chronic pain, that is why this organization was founded, Minorities for Medical Marijuana. We are focused and patient driven. We also have a safe access program within our organization in which they've started in Florida. We really want to shout out to DJ and Brian and everyone that's leading up that program. So with the Minorities for Medical Marijuana Safe Access, patients can actually come to our events. They are going to be in person and bring their identification, and they can actually sign up, see a physician, and obtain their medical cannabis card. That is right. Our next safe access program will be September 24th in Philadelphia. So please, for more information, be sure to follow us, M for MM United. Go to our website, m4mmunited.org, and learn more about our safe access program. Dr. I know that some of the conditions that are included in medical cannabis programs are such things such as end of life care. As a retired paramedic, I find that monumental because the reason you put patients in hospice is so they can pass peacefully. What do we need to get more physicians in the in-hospital setting to recommend cannabis? And what impact could that have on end-of-life care and palliative care?
Thank you so much for bringing this topic up because, I call it the exit drug for that too. Because I got involved in this because my mother died and I never gave this plant to her. And I still I have my own trauma issues, but I've become a badass to talk about it because I really support the fact about death and dying and palliative care, oncology. These two doctors out there, or anybody that has to deal with hospice, palliative care, please understand that this is definitely something that you can offer them, not just for the patient, it's for the caregivers, it's for the families, it's for everybody, and even for the clinicians that are taking care of them. You're going to have something that you could give them so that they're not just drooling and dying without any dignity. They can actually, I'm very proud to say, I've had my family members that will call me after the family member has died that I've cared for and say, Dr. Uman, thank you. Thank you for letting my parent or my family member die with dignity and let them die with us at home and not just being somewhere alone. And we were able to see such a joy in them. And I had a patient call me. She had polymyalgia rheumatica, and she had been on Clonopin for over 25 years. Over 25 years. And within 2 years, there's no magic wands I have, folks, but definitely follow-up care and caring for our patients. We got her off the Klonopin, we got her acclimated and slowly be able to use the cannabis in different ways. And the family got to enjoy her and be with her and let her die with dignity, share her story. So this is why I call it the exit drug also. Not just for the elderly, I have children, sadly to say, that I know that we don't have all the answers for their diseases, their seizures, their rare tumors, their conditions, and we're able to give the parent something, that child something. And nutritionally, hemp. I'm a big fan of hemp. Get it in your system in different ways, and nutritionally get your immune system. I don't care if you don't want to use any form of marijuana. At least get the hemp in you to make you a little bit healthier.
Okay, Dr. Bennett.
Dr. Uma, thank you for that. We love hemp around here too. And one of the things that I had a client that was dying from pancreatic cancer, and her husband reached out to me to get her something other than morphine to be on, because in her last day she was not able to eat or have a conversation with her family because they had her on such heavy narcotics. And so the RSO helped her in her end of days. And so I know exactly what you're talking about. Instead of being sedated, she was able to, have a conversation with her family. And so one of the last questions I have for you before we go to our next guest, hi Denise, is what do you recommend that we can tell doctors, or that we can tell legislators to allow doctors to start recommending cannabis in hospitals, in a hospital setting? What do you think are the steps to getting to that point?
At least start with palliative care patients. Start with the patients that have hospice, the patients that have end of life, where you say, I've got nothing. You've thrown your hands up. Send them our way. Offer this as an option. Have places that we can create where we can do the research on them and see where they come in, how much quality of life for the patient. Can we give them something a little better than this? And honestly, I say yes. And why not? Because one of the statements I clearly have said out there repeatedly is, please remember, all patients are not healthcare providers, yet all healthcare providers are patients at some point. So think about it for somebody that you love, maybe for somebody yourself, or you're the patients that you take care of. That's my words of wisdom.
Thank you again, Dr. Uma. Ladies and gentlemen, you're getting it straight from the source. Tonight's information is not he say, she say. These are facts. And we are proud to have our special guest here, Miss Denise Butler. This is very near and dear. Miss Denise Butler is the mother of one of my childhood friends. I did not know her story until not too long ago. And when I heard it, I knew we had to bring her on. So Miss Denise Butler is a native of Griffin, Georgia. She is 66 years old. She is a mother of 4. Miss Butler suffered a bicycle accident on January 21st, 1998, where she was struck with a vehicle. The accident left her with 17 different fractures, including breaking both sides of her mandible, both knees, reconstructive hip. She had to have joint fusions. She currently has metal plates, screws, and a plastic chin due to the level of facial reconstruction that had to happen after her surgery. She had over 8 surgeries and endured years and countless hours of physical therapy. According to Ms. Denise Butler, she stated that she trusted physicians due to her severe condition and thought that they were giving her what was best for her. As a result, she has now been a chronic pain patient for over 20 years. For many years, she was prescribed 100 milligram fentanyl patches, and she was even prescribed 10 milligrams of methadone at a rate of over 550 pills per month. She is currently still being treated for chronic pain, but luckily she has been able to begin to research alternative wellness, and she is now searching for a potential at-home relief, not only for her, but for other people her age. I would like to welcome Miss Denise Butler. Welcome, Miss Butler.
Hello, how are you? How you doing?
We're doing
I
great.
apologize for the wait. Um, it has been a very long struggle for me. Was leading a very normal life until I got hit that day on the bicycle. I fractured 17 broken bones and had 8 to 9 surgeries. After that, physical therapy and tons of opioids, tons and tons. And I asked my doctor one day after they started to bring them down, why was I giving so many opioids? And he said, because we thought that's what worked. And the funny thing about it is when you go to a pain clinic, and if you have any kind of cannabis in your system, you're kicked out. So I'm like, but it works. But I don't understand it. I don't get it. I feel as though it should be legal to help people like me and other people. I've suffered stomach problems from the use of the opioids. Because of that, I have to have something for pain, or my blood pressure goes up, and then you have kidney problems. So, what do? I need some help, and I need it now. I'm not a spring chicken anymore, so I need some help bad. And I'm
So,
willing to,
Miss
at this point
Butler,
to help.
you said that
Yes,
you want to try these new products, and what are some products that
I
you've
do.
had, and what
Yes.
worked for you? Tell us about some of the products that you've tried, and what currently works for you, or do you even have access to medications, medical
You mean
cannabis?
the cannabis? Well, I was told by, I think it was by you, not to buy them off the, like, from the service stations and stuff, that they were not really safe. You want to get them from somewhere safe and FDA approved or whatever, which is hard to do. I've got some from my pharmacy once, and he couldn't get them anymore. They were wonderful. They worked. They helped. But when I went to my pain doctor, they told me, they gave me another chance, that I couldn't have it in my system and all of it. I'm like, but why? I mean, I was able to come down just that month off my dosage of very high dosage of opioids with the cannabis. But I had to stop because I couldn't go back to the pain clinic, and I couldn't get, the pharmacy didn't have any more of the cannabis. So I'm looking for a long-term cannabis problem solver. I want to continue to, use and find some that's safe for me. And I know other people that need some too. I have a friend that has neuropathy. She doesn't know what to do. So we need some help.
Yeah, and
Bad.
unfortunately, you live in a state where it just having access to that help is just not there. That you don't have access to safe medicine in that state. Unfortunately, I know that's why I left Georgia and had to move to Nevada. And so yeah, right. I know everyone can't afford to do that, but that was my reality at the time. I was a patient refugee leaving the state of Georgia because I did not have safe access to medicine in the state. And so, how did dealing with your chronic pain affect your ability to perform as a mother and caretaker while you were dealing with the pain clinics, being treated by the pain clinics?
In my mind, I knew that if I sat still and got on a pity pot, that I would be bedridden. I knew that. So mentally, I knew I just had to push myself. Still doing it to this day. I mean, I can't travel because when I ride over an hour, 30 minutes, I can't get out of the car. You know, so it's hard. It's very hard. And cannabis works. and it's safe. So you can ride with that and take one or do whatever. But here you can't do that. You find some crumbs in your car and you might go to jail in this town. You might get taken to jail, not a ticket, but to jail just for less than an ounce. Unless you're on
That
juice. Yeah,
that's
unless
right.
you're on juice. So
So, Miss
it's
Butler, as I
just I don't know
stated
what to do.
Ms. Bucks, like I stated in our phone call, one of the things that I want to try to do for you, see if we can get you to one of our clinics. I'm going to be more intentional on trying to provide even more local education and resources like our safe access programs. I know that we're waiting here in Georgia for the licenses to go out, and we have patients that are really needing the medication. But I want to see if we can work on getting you a trip with me. We'll go to a state. We'll actually take you to one of these facilities. We'll sit you down with one of their physicians and actually let them, examine you, let them talk to you. Let's, bring you on, because it takes a lot of courage to do what you're doing right now. I remember when we told you about this event, that you had never done something like this. And we need more patients telling their stories. Here at Minorities for Medical Marijuana, our organization as a whole is a story in itself. Our founder, Ms. Roz McCarthy, has family members that have used the resources, that needed the resources that we provide, whether it was education, whether it was advocacy, or even access to the medication. And that leads me into the question regarding to Dr. Uma. Dr. Uma, so you've learned from our patient that she has a plethora of comorbidities that come from her accident, from the surgeries to the trauma to the reconstruction. Where would you say we should start to create her a long-term regimen for getting her safe treatment with medical cannabis related products?
Denise, first of all, I apologize and I'm very sorry for everything that you've gone through and the system and your injury. And I've been there, not to the extent that you have, but honestly, the doctors really feel like that's what they gave patients with what they had, their research, there's that word, their research, and was able to give you this. And, this is what we were told. So, but we were never told, I was never told, and even now, most doctors still are not told or taught about the endocannabinoid system. Okay, so as soon as you say system, we know that there's a balance. If the system has a balance, we're good to go. But it's under functioning or over functioning. That's what you got to look at. Is it one or the other? So when we're looking at the functions, the endocannabinoid system is involved with pretty much every system in the body. And because you've had injury throughout the whole body, you can, and you say, and now how using a little bit of cannabis impacted your pain and you were able to reduce. That's science. That's the endocannabinoid system working. Now, the fact that you also mentioned pain clinics that tell you because you tested positive for THC, out the door. And when I came to Massachusetts, they would hang up the phone on Dr. Uma. They would say, cannabis, they tested positive, bah, 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 bah. Not even that. Click. Today, I am proud to say that those pain clinics have changed their policies. And what they've done is said to the patients, look, if you're going to test positive, go get a medical card so that at least somebody is monitoring you. You are a legal patient. I even have patients now where doctors will say, go see Dr. Uma because she will monitor you. She will follow you closely. And that's what I would offer to my patients and anybody. We do this for people all over the world. People have a card, they still don't know what to do because they were not educated. And this is serious stuff. People who are on these meds, you cannot, let's get the message out there, abruptly discontinue medications, especially these SSRIs, people for mental health issues, benzos, pain medications, because you can be into where it can be deadly. deadly, because they are addicted. And those kind of addictions can be deadly. Not with cannabis. Cannabis, you'll feel like you're anxious. You're not going to die because you abruptly stopped cannabis. But that's not what it is. You also mentioned, I can't take my medicine. People can't go from one state line to another state line carrying their cannabis, but they can take all their opioids anywhere, package it up, and carry it throughout the world. Okay? But they can't take this plant. So I've been fighting for this, literally fighting, fist pump in the air, open my mouth, literally, but I am proud of it, and I'm proud of you. I'm proud of what we're doing here. Because at the end of the day, I'm going to boldly say, we ain't white. We ain't white, and I ain't white, okay? And it is about racism, sadly to say, and it exists all over the world, even in my own country, okay? That's okay. Let's just acknowledge it, and move on. And the fact that patients can't get this covered with their insurance company, many patients stop using the cannabis and go back to their drugs because they can get it.
Thank you so much for that. So much.
Take Miss Denise, I think, wants to say
Oh,
something.
let her
She's
talk.
on mute.
Let her talk.
You have to take yourself off mute, Miss Denise. We can't hear you.
You, what happened?
Oh, there we go. There we go. We can hear you now.
Okay, okay. I told her, the doctor, I'm with her 100%. Wherever she go, I'll go with her. I'll do whatever I can because we need someone. We need a voice, and nobody listens to us. You know, the last time I spoke with my doctor, I told him that I wanted to come off the pills. You know what he told me? We can put a pain pump in your bag. And I was like, what? What? Well, what are you gonna put in it? Oh, it's an opioid. I'm like, what? You don't get it. I want to come off of the, and I can't. It's crazy. A pain pump in my back. Go from my back, from my mouth to my back. I don't quite
It's a
understand.
diagnosis code. They can get it reimbursed by an insurance company. The day I tell people, look, if they're ready to do that for you, please send them our way. If you're, give me 1 year with this patient. Okay, give me 1 year with 10 patients. I beg all of these people out there. Give me 10 patients. Let me have them for 1 year, and we shall show you what we can do. I think
Absolutely,
I'm
ladies.
challenged.
As you can see, we're making connections, physicians, patients, viewers, advocates, and supporters. We're coming to the end of our show. Dr. Uma, Ms. Butler, we'll start with Dr. Uma. Please tell our viewers how they can find you, how they can follow you, and how can they get more information regarding uplifting health and wellness. And Ms. Denise, we'll let you close out as well from the patient side. So Dr. Uma, tell our viewers where can they find you and how can they contact you?
First of all, I want to say thank you to all of you and everybody that's listening. Some of the philosophies I just want to leave you with is reach one, teach 10. Reach one, teach 10. Whatever you learned today, please share the knowledge because that's what it's about. Every one of us has to take this out there and ask your doctors, what do you know about the endocannabinoid system? Learn to say that a couple of times. You can reach me at Uplifting Health and Wellness, kind of long, Uplifting Health and Wellness.com is our website. Uplifting Health and Wellness at gmail.com is our email. There's some handles out there for our Twitter and whatever else not. I need some help with that. So people that want to help with social media and pass the word, please share the word and help me with that. But you can reach us. Our phone number is 508-444-2324. I'm going to be in Georgia for an event on October 18th. I do certify patients in Georgia, Massachusetts, Maine, Connecticut, Vermont, New Hampshire, and the state of Washington. And we do consults for people all over the world. So please, no question is not, it's open for discussion. So if we can help, and we're also a concierge practice. We take care of all ages. And Stanley knows how to get a hold of me too.
Thank you so much, Dr. Uma. It's always a pleasure. And Ms. Butler, take yourself off mute and tell us how we can find you if anyone wants to contact you, how can we reach out to you?
Can you hear me?
Yes, we can hear you.
All right.
Tell our viewers where you are and how can they find you and how can they follow.
I'm in Griffin, Georgia. You can reach me by phone 404-710-9127. Again, that's 404-710-9127. You can always call me. I feel more hope than I felt in a very long time, thanks to Stanley. He speaks very highly of you, Dr. Uma, and thank you. Just thank you all. I'm looking very forward to being you.
And thank you, Miss.
No, thank you so much.
Okay.
Yeah, thank you so much, ladies, both of you. Dr. Uma, we love you so much over here. Thank you for all the work that you're doing and advocating and for patients. And Miss Denise, thank you for your transparency today and being so brave to come on here and really tell your story. Thank you so much. It takes a lot of guts to do that. So, especially living in Griffin, Georgia, I know. But folks, it's been another wonderful episode. If you missed it, please share with your friends, share in your network. These recordings will be on our website and on our YouTube channels and on our Facebook channel, as well as our LinkedIn page. So make sure you're sharing. Go find it, send the video, share it with friends and family that you know can benefit from this conversation. And thank you, Stanley. Thank you to our co-host. My co-host in Health is Wellness. On Friday, though, you don't want to miss it. We're going to have the last episode in our series this week, and it is going to be on pregnancy and cannabis. You do not want to miss that. We'll be talking with Dr. Felicia Dawson and the founder of Cannabis Noir, Sheena Robertson, and really having an in-depth conversation about all the questions that come up about using cannabis during pregnancy, how it affects the baby, all of those questions, how it affects the mother. So thank you again, everyone, for joining us. Thank you so much. I hope that you all have a blessed evening wherever you are in the world. And make sure that you follow mmunited.org is our website. We will see you on Friday at 4:20 p.m. Pacific Time, 7:20 Eastern Standard Time. Thanks so much again, everybody.
Good night, everybody.
Oh, good night, Dr. Uma.
Thank you. I'll see you soon.